Let's please welcome to the show Representative Rich McCormick from Georgia. Representative McCormick, thank you, Rich. Good to see you. Do you know Wayne Frederick, president of Howard University?
Pleasure.
You know, he's producing people. I mentioned the military because our topic here is the white coat and the uniform. Rich, of course, a doctor, but he was a Marine Corps and Navy veteran, helicopter pilot. In Africa, the Persian Gulf, Afghanistan, an emergency room physician. And I've had him in a number of, I do a lot of national security stuff.
Don't forget Morehouse.
Yeah, there you go. And so we've had a lot of conversations about national security stuff, NATO stuff, and Rich always brings up basically the heroes in healthcare that are serving the country, that are out on the field, that are kind of doing great things. And as we kind of look at that, I wanted you to meet Wayne because, Wayne produces right here in town a very important, we were talking about the pipeline, so I'm interested in the pipeline as well in the military side. But why don't you, as we're thinking about bold bets and taking risk in healthcare and rearranging this, would love to get a sliver on what you think we need to do or can take advantage of the backbone of the healthcare of the Department of, I used to call it Department of Defense, I guess Department of War now. I was a DOD brat, so it's hard to change. But when kind of looking at that, Rich, what are the things that we can learn from that you've been a part of that could help deal with some of the other challenges broadly in American healthcare?
I think we're at a pivotal point right now. If you look at healthcare, its disparities, the expense. I actually take note, you said 1/6 of the economy, 1/5 of the economy now. It's grown. The administrative cost used to be around 10%, then it went to 17%. By the time I was in medical school, it was 25%. Now it's 30% is the administrative cost of healthcare. 30%, almost a third of every dollar spent on healthcare is administrative. Where does that come from? Health insurance companies that basically say they know the numbers, they know that there's so much wiggle room that they can basically deny a third of all claims. A third of all claims. A third in the ER of 40% and get away with it, knowing that you're not going to pursue them all because it costs you about $300 to $400 to pursue it. And they do it on purpose, knowing they're going to get away with it, making 240% more net profits since before the Affordable Care Act, watching doctors' compensation go down by 30% since the Affordable Care Act.
And he said these doctors, leave his place with $250,000 of debt.
Yep, and not to mention the cost of education going up. The two biggest inflationary costs to America, what are they? Healthcare, monetarily, is second in percentage, first in just sheer cost, and education, number one in inflationary cost as a percentage. What two things has government become increasingly involved in the last couple decades? Healthcare and education. The government is the problem. We are the problem. When we say, I'm gonna guarantee you a loan at any school you want for any major you want, and so we get majors that don't apply to society, when we have an antiquated educational system based on didactic training in all schools, which we've had for hundreds of years, that's not working, that since the establishment of the Department of Education has seen nothing but a decline in American education, where we're producing less and less STEM students, so relying on foreign students to come and fill those in our higher education systems, which is the best in the world, but then sending back to the countries to compete with us. What are we doing? Why not use AI to streamline the way we actually figure out how kids learn? Encourage them towards STEM learning. Encourage people who are in minority status who are not traditionally performing well to do better, to actually, and you're not gonna replace a parent. There's no replacing parents, right? Parents are the absolute start of everything that's good or bad in our society. We can't replace, any government agency comes in and says, hey, I'm gonna fix it, beware. We're not the solution. But we can help in many ways. And I think if we can start forcing our people towards using AI in the way it was intended to enhance us, to enhance our billing.
Real quick, Wayne, is there a way, I'm just in the university format, are you using AI to supercharge your training? Are there ways to bend the cost curve from your perspective, as Rich is saying, in the AI space from a university perspective?
Yeah, yes, absolutely. When you look at the university course in higher ed, a lot of it is bureaucratic, and now you can use AI for a lot of those things, right? Look at my financial aid office, having every student go to see a financial aid counselor, you can use AI for maybe 80% of the things that
Are
they
you
would
going to be
look
the
at.
AI agent at Howard University, reducing the bureaucracy of your university?
I think there's a lot of fear mongering around that it would replace people. What I would say is it gives us an opportunity to retrain and reclassify what people do within a system such as higher ed, so that you can take away some of those administrative costs and really focus on, what we want people to focus on, which is how they learn.
How many? I didn't see when you asked how many doctors are out there. How many doctors out there? Physicians. Okay, so you're not raising.
We have them out there.
high,
They're,
but okay.
they're scared I'm
I
going
get
to call
it.
on them.
Yeah, I get you. So here, I'm not going to call on you, but here,
Yeah.
you guys know that we have a massive problem, and that when we bill, there's automatic. Imagine if we wrote legislation that, by the way, corrected the HIPAA problems we have too. But imagine if, as an insurance company denies you and you win in litigation because it's a 90% standard of care, that they get punished and you get a $300 check per denial. Mm-hmm. You know how transformative that would be?
Yeah.
Think about how that would be. Yeah, the doctor's like, F yeah, right? I don't know, I forget what the F means, but anyways, the point being, imagine how transformative it would be. You could reduce the administrative burdens from 30% down to 20%. Imagine what 10% of $5.4 trillion is. That's how much we spend on healthcare, by the way. $5.4 trillion per year. And I would argue that $1 trillion of that is wasteful. That's the GDP of most countries.
So, Rich, so I pretty much agree and align all with the things you're saying. What I don't understand is why so much money is chasing the unproductive parts of the healthcare ecosystem. Yet when you look at future science investment that the US government has traditionally supported, there's a ton of slashing going on in that right now, which to me is, how we got the internet, how we got, GLP-1, how we got, various kinds of things out there. Are you worried that we're preserving the crappiest parts of the healthcare system and we as a government are slashing the things that might actually give us the next big leaps?
100%. What holds back progress is lack of competition, whether it be in the insurance agencies where we have overregulation, the EMR industry where they can't access, where we can't communicate, litigation. We have about 10 times more lawyers than doctors in Congress. That's a problem. Because once again, there's a conflict of interest. But if you look at the advancement of anything, it's always through competition. That's what's made America great. When we regulate ourselves into oblivion and when only a few companies can fulfill the regulatory burdens, that's why now, since the Affordable Care Act, half of all physicians in just a couple decades have gone from private practice into hospital systems, whereas 30% more expensive. And by the way, we're punishing you every year with decreased Medicare and Medicaid reimbursements. We are part of the problem again. And I think to answer your question, we need to start thinking outside the box. And we really need to get serious. The problem is the biggest lobbyist groups in DC have the most money. Where's the most money? What do we spend more on than healthcare? Nothing. The bigger something gets, the more inefficient it is. Ask the government, right? We have a tremendous amount of waste, fraud, and abuse we can't get rid of because why? You have so many people wetting their beaks in a $5.4 trillion industry. We spend no more money than healthcare on anything. 30%, over 30% of our budget, our non-discretionary budget is spent on healthcare. 18% on Medicaid, I think, and 17% on Medicare, or maybe reverse that. But it used to be Medicaid was all state run. It used to be 1/3 of all spending by government was federal. Now it's 2/3 and increasing. And we're in 30% deficit spending per year. You think your kids aren't gonna pay for that? You don't think that's gonna come, that bill's gonna come to pay within the next 6 years? You watch. Medicare will go bankrupt, Social Security will go bankrupt. It's predictable, and we will falter as a country when we can no longer pay the debt servicing per year. It's happening. Get ready for it.
I know this is wacky, but I'm seeing, that Wayne is a very creative thinker. I've talked to him a lot in the past on various things on why we're not able to shine a spotlight on the worst parts of this system and fix them. We used to basically, hey, why don't we have a White House summit on changing the game in healthcare? But, you're a member of Congress. You're like a co-equal branch of government. Why can't, Rich McCormick have a congressional summit on changing the game in healthcare?
Well, we had Doctors Caucus meeting this morning, literally on some of these topics. I had the presidential staff over to my office last week. We actually looked at their 6-point promise and plan, gave them a lot of feedback because some of it's not entirely realistic. Realize you have policy people who have never spent a day in medicine in their life trying to come up with solutions.
Wayne is nodding vigorously with that. Yeah.
Absolutely.
And there's the rub. You have people who come into administrations who are connected to the president, who are very well-meaning, but seldom are experts in that field. And so that's part of the problem. But we give a good feedback loop, and I do feel like the president's listening. I think we should be able to make some incremental changes towards what's good. It'll never be great because, as you guys know, it's a lot run by government.
You know, one area before we go, and I really appreciate you both hanging out here, but we've got Alicia Jackson coming up. I don't know if you know Alicia. She's fantastic as head of ARPA-H. But I am interested, we have a pool of former service members, veterans. We have Veterans Administration. One of the things I really tried to do today, and I was trying to get some friends from DOE, Dario Gillen, over, and he wasn't able to make it today, but people outside the silo of healthcare to look at how you might impact it. You know, the Department of Energy has traditionally had all these supercomputers, all this information about veterans' health. Like, the Department of Energy matters in the healthcare picture. We have NVIDIA, Anthropic, Google in the room here as part of it. So kind of looking out of that shell for figuring, are there ways to use new tech to kind of come in and disrupt the status quo and inertia in the healthcare system. But I guess my question on this is, we're sort of looking at shaking up some of this, and we've got ARPA-H coming up here to figure out how they're going to do it. What do you think, by way of veterans, and the fact that you kind of have a population there that we could be moving more expeditiously on and addressing it in a way that is kind of R&D on how to be better, and then to bring that more broadly into society?
Now, ironically, veterans are the one group that you can say are under a one-payer system, right? It's almost like a sample of what government-funded healthcare could be. And you can see how well we've done with it. I think we should have a BRAC on VAs, but it's never going to happen because you have a hospital in South Dakota, for example. Imagine 2 senators saying, yeah, we're going to let you close that hospital down that has more administrators than patients per week. And not to mention keeping the lights on in the hospital system, when you could send them out in TRICARE, have 10 times better healthcare by people who actually practice acute healthcare. But that's the protectionism of the VA. And I think you should close VAs that are not performing. They're all autonomous. They have autonomous supervision. But I'm a big believer in do what's right for the patient, right? That's, as we physicians look at healthcare, do what's right for the people. The problem is that there's a lot of people, once again, wetting their beak in the government, and protectionism has always existed. Even in BRAC, when we were trying to close and realign bases, there are always people, not my base, close those bases, but not my base. And that's the problem with government. But once again, if we can start exposing this, as people get more information, they lean on they changes the narrative. But you can see it's very hard to compete with Iran and Israel and Taiwan and Ukraine, and that's just foreign. We have a few things going on in domestic policy too, so it's very hard to get through all the clutter of the media, not to mention your TikTok views, which are kind of...
Wayne, are you into rugby at all?
No.
No, okay, well, that's going to try to get you guys together again, but it might be difficult because, one of the cool things about Rich McCormick is he's chair of the Congressional Rugby Caucus, which is really cool.
Okay. I thought he was
chair of the Men's Health,
caucus.
or co-chair of the Men's Health Caucus,
last night.
and the GOP Doctors Caucus. And so really, really appreciate you both joining us here. Congressman Rich McCormick, thank you so much. Wayne Frederick from Howard University. Thanks, my friend. Thank you. Thank you, Wayne. Thank you so much.